today our episode is dedicated to women's health. Today we have Andrea, who is an exercise therapist, and we have Seham, who is a women's health physiotherapist. Welcome.
Hello. Thank you. Thank you.
Well, ladies, thank you for joining us today. How about we start with you sharing a little bit about what it is that you do and what drew you to your field. Seham?
I'm a physical therapist with a specialization in pelvic floor rehabilitation, which basically interchangeably we use as well the term women's health. And what drew me into this specialization is that I wanted to spread more awareness about women's health, about pelvic floor, and that I have some issues going on with my digestive system, which I have Crohn's disease, which as well affects my pelvic floor. So for that reason, I wanted to study this field. I wanted to know more about it, and I wanted to help other women that they're going through the same thing.
That's amazing. Thank you for sharing that. What about you, Andrea?
I'm an exercise therapist, a holistic health coach. I specialize in posture correction, body misalignments, and muscle imbalances. Also have a university degree in nursing, and I spent 10 years of my life on that side of the field, of the medical field, right? Seeing people sick. And it really got me into more exercise and helping people rather than preventing the disease instead of fixing it. I'm a mom, I have 3 kids, and I believe body is made to move, right? And everything is all connected. Body is connected to our emotions, to our physical body, to our behavior, to what is around us, and how all of this, something that is affecting one thing, can affect the whole body itself. So my purpose basically is to help to prevent the injuries instead of just fixing it, and everything through exercise.
That's amazing. What a history. All right, so Seham, since you are a specialist in pelvic floor health, what is it that you wish more women knew at a younger age about their pelvic floor?
If there is something that I wish that we could actually change, is that pelvic floor rehab or women's health rehab, it's not only related to one stage or one phase of life. So, for example, if you are getting your period and you're noticing that there is some kind of changes, you're having some pain. So this is where we actually go and seek for help. So what we have right now is this kind of understanding that it's only related to one stage of life. So for example, postpartum or prenatal, this is where we go and we check with a pelvic floor specialist. So we all have pelvic floor. We all go through different life stages. So it can actually go from the moment that you get your period, all this kind of pain that you go through your period shouldn't be normal. So I wish that we actually can spread this awareness that it's not only to one stage of life. Yeah.
All right. So, Andrea, since you have a long history with fitness and training, what is it that you wish you knew about female body movement, maybe earlier?
I started at a very early age into sports. Okay, that was my major. And honestly, I had a really good foundation, and that helped me a lot through the rest of my life, even like to recovery from all stages I've been through, having my kids, postpartum, until this stage I'm out. I'm over my 40s. Maybe the one thing I would really like to know is there should be more guidance for women to prepare us for this stage. Because you just go to the gym, you have no guidance. They treat you like you can just exercise like everyone else. You can exercise same as men. And it's okay, like if you have athletic backgrounds and, good genetics for sports, but not everyone has the same. So we're being pushed as women to exhaust our hormonal systems, basically. And if we don't have careful with this, you gotta pay the price, especially at this age, because you're gonna start into this roller coaster of symptoms within your body. Fatigue, feeling like not just hot flashes, but feeling like all exhausted all the time, having like all the symptoms within your body that you no longer feel yourself. And it's really, really, really hard to get the women back on track after start having all of these symptoms, and especially throughout our lives, because this is going to represent a lot of difficulties in our daily lives, in our jobs, in our lifestyles. So I think it's really important for women and who are experiencing this or who are entering to this stage where our hormones are changing and our bodies are changing and they don't respond the same and we lose muscle mass, that actually we need to some guidance and prepare us for this.
That's true. There's no knowledge. It's just go to the gym.
Just go to the gym, go work hard, no gains, no pain. So no, it's not like that.
All right, so ladies, since you both have a very strong background in female health, actually, what is it that you think is missing in terms of knowledge about pelvic floor, postpartum, and all these female-related situations? Because it seems to be such a taboo. People don't really talk about it.
I believe part of it is because of the cultural stigma and our educational background. So girls, when they are in school, they don't get this as part of their education. And talking about the woman's body specifically, it's a big taboo in our culture. And what we actually have gained or have basically inherited from our generation, okay, that it's not okay to talk about what women go through. For example, like pelvic pain, period pain, the changes that women, they go through it during pregnancy, postpartum, and even the changes that women go through during their menopause. So we should actually start to talk more about it, and in a way that we need to raise more awareness. So we have to stop this kind of cultural stigma, I believe. Yeah.
Completely agree with her. I think it's mostly the lack of education, that they don't prepare us, they don't teach us as women. We just seem everything like normal, right? Because there has been no education, no one properly taught us and telling us this is related to this, has a lot of relationship as well, how we engage and feel things within our body store emotions as well. And I believe as well, there is a lack of proper education in terms of movement. How, since young age, we should be taught and guidance and make us understand that movement is a physical necessity as much as sleeping, breathing, going to toilet, eating, having fun should be a must, because we need this for our bodies to keep the body healthy. And a big portion of what she's talking about, pelvic floor related issues as well, is the lack of strength around the muscles in that area as well. Like muscles, they gonna become weak is a huge term, and it's a huge subject to talk about pelvic floor, because by itself it's a big muscle and like really good inner unit muscle to keep us for posture. But I believe there is the need for educating younger people and to make women to understand that symptoms and hosting traumas within our body needs to be healed and released. And at the end, the body will just express what we're not saying.
1000%. Even as a psychologist, this is what we always work on, what we always say. So when we speak about postpartum, whether it's like 6 weeks postpartum or 6 years postpartum, what are some of the signs that you would say, okay, a woman needs to come and see a physiotherapist?
So first of all women need to go and check their pelvic floor and check their core after giving birth. Okay, this is like, we have no debate about that. Okay, so there are clear signs, for example, starting as simple as low back pain, pelvic pain, pain with intimacy, and as well like things that are vital, for example, like going to the bathroom, having constipation, even having some leakage, urine leakage, something what we call urinary incontinence. So these are clear signs, okay? But there are other things that sometimes even when we talk about the pelvic floor, if it's related and if women need actually to go and check with pelvic floor specialists, is sometimes we call the pelvic floor as, is it the victim or the driver, okay? So as I mentioned, like sometimes there are something are unclear, like the low back pain, the pelvic pain, but this could be sometime more into like fatigue, complete kind of like water retention. All of this can indicate indirectly that maybe the problem is coming directly from your pelvic floor. So yeah.
Okay, Andrea, so you said you had 3 kids, and that means 3 pregnancies. How did you approach them differently each time after giving birth?
That's fun, because I think this is related to one of the questions you asked me before. I didn't. No one taught me. There's no education. This is like example of what just everything we're discussing right now. But one thing it did help me a lot was my foundation. I started in a sport, so being an athlete, it's different than just going to the gym and doing bicep curls, right, or shoulders or whatever. So I had a really strong body, and this body has driven me through my whole life and has helped me to recover, even if I didn't realize I wasn't, But there was not actually a proper recovery or someone who taught me. And like even in hospitals, or when you come after having your kids and you come to the next meeting with the doctor and tells you, okay, let's check you. There's not such a thing like that. They just send you back to life, go do whatever at home, be a mom, be this, go to work. No. But there wasn't actually a proper recovery or guidance for me to tell me, do these exercises, do this. No, my body, thank God, is strong, and it had helped me into recovery from my pregnancies, even though it was 2 natural births and 1 C-section. But I will tell you, with the C-section I did have, and still until this age, like I had like some consequences after that, especially within my core area. And this is why I like to help people, because as women, no one taught these things. No one telling us like why, especially when they come and tell me like, this area here, like I cannot make it loose. And I'm like, I cannot make it straight. Why is it big? Like because of my pregnancies. It's like, because you still don't know, you don't understand, like your posture, everything is related to this and with the pregnancies. So that's really my aim. And like, I really want to bring awareness and for people into this.
At least they can actually relate to. I think that really helps a lot of women, that to know that there was someone there in their place and they were able to recover and become stronger and go back and bounce back, And that's, I think, that bouncing back, it shouldn't be like 100% as pre-pregnancy. And I think this is something that can guide a lot of women, that it's okay and it's fine.
Exactly. Yeah, exactly. And still, like you can recover from this, even though after years, right?
Yeah, that is amazing, because it seems like for both of you, your passion for what you do is driven by your own personal story.
It is.
Yeah. That is so amazing, because then you're passionate about people you're helping and the stories they're going through.
Makes you happy, right?
It does. It really does. All right. So Andrea, you train women of many different ages. They're young athletes. They could be women in their 50s. They could be any kind of demographic. How do you adapt your training methods differently depending on the stage they're in?
To just answer the question, depending on their stage of their lives, it's completely different. It's different to having a teenager who are in their fullest hormonal stage and they're like little superhumans and they can recover faster than having women in their 30s, in their 40s, in their 50s. You have to first to analyze, you have to first do a lot of assessments with them to see exactly what is going on in their lives, how is their capacity, their recovery, the stress in their life, their hormonal level, and exactly what they need in that moment. Do they need more therapeutical exercises? Do they need more corrective exercises? We can push them? Do they need more strength in this moment? So it depends a lot of the person itself in that moment and their specific needs, especially for their goals too.
So it really just depends. So Seham, is there ever a point for women where it's too late to come to physio for pelvic strength?
So briefly, I would just say it's never too late to go and visit the physical therapist, okay, when we're talking about specifically pelvic floor rehabilitation. So, but the earliest, the better. So for example, sometimes I have women that they give birth 20 years ago and they just come now, they just decided to go for a proper assessment. And then they found out that maybe all these problems that they've been having all these years is actually coming from the pelvic floor. So there's specific time that we always say it's better to come now, the earliest the better. For example, if you give birth, we always say, if natural, 6 weeks postpartum, a C-section from 8 to 10 weeks postpartum. And when we're talking about any kind of surgical procedure, like it's around the abdominal area, anytime after 6 weeks as well, it's a good time to get a proper assessment. So yeah, my answer is never too late. No, yeah.
The early intervention is the best intervention. So how can women protect themselves from injury or burnout when they're pushing to train or be stronger?
First, you have to understand your symptoms. What exactly is happening? If there's something in your body telling you, I can't push and you're pushing, trying still to push, pursuing something, and your body's telling you the contrary, you need to understand where this is coming from before trying to do that. That's the first thing. Injury related, because if you're pushing and your body, for example, is exhausted, you're in a burnout condition out of work, family, lifestyle, and all the stressors around your life that might be causing this, and not just within your proper life, but you have to check out as well the stressors, chemical stressors, environment, nutrition stressors. All of these things matters because it's a combination. It's like a chain. It's going to affect any of the systems that controls your body. So that's the first thing you need to check for. Because right now my body is full rising in cortisol, right? And I go and push. And physical exercise as well can be another stressor.
Yeah.
So that's the first thing you need to check on exactly to give the person in that moment what kind of exercises do they need so you don't injure the person. Tendons, ligament, disc, and as well to assess their body, their posture. What do they need? What do we need to strengthen? What we need to release? So it's a whole combination of things. What stage is there in? How old is this person? What kind of medical history this person has? So it's a very integrated thing. It's not just one thing. And this is the best way that you can do this. But you have to seek for personal, and someone that you can trust, legit, and who know what it's actually doing to put your body and your trust into this person.
I believe one of the most important things that we're lacking is listening to our body. And that's why we're living in this kind of society that nowadays we're like an autopilot. We're just going with the trend. We don't listen to our symptoms. We don't listen to our body. So it's really important for women to be more connected with their body, to be more connected with their cycle. So it's not that a way that they only have to track their cycle or just make it a little bit kind of complicated. Just simply to listen. If they're not feeling okay, if they're feeling tired, maybe if you're an active person, instead of just going to a very strong, impactful exercise, just slow it down. Go, for example, to something like Pilates, yoga, or something like that, or even your kind of exercise that you're training, just decrease the load if we're talking about an active person. And in general, again, this kind of thing of listening to our body, knowing what we're going through, feeling what we are going through, okay? Knowing our symptoms is really important. And this is what we're trying as physios, as exercise therapists, to implement in our patients, to be more aware. And it can start as something as simple as understanding their breaths, and noticing how the breath is going, how their breath is changing, what's the tension in their muscles, where do they feel the tension. So that's really important.
Yeah, that's very true. Listening to the body. Seham, how do you help women feel safe, especially when it comes to people feeling embarrassed about the topics of leakage, heaviness, or even period pain?
Well, thank you for this question. I think it's really an important question. So first is to provide a safe environment. And when you're talking about the safe environment, it's even how I prepare the room for them, and even the way that I talk to them, the way that I try to get the right question. And there's another important point is once we just know that, okay, she's going through this, they will feel shamed or feel embarrassed about this, just to let them know that they're not the only one they're going through this, that it's very common, not trying to normalize it, but it's very common. So there are many factors actually that are playing here. So it's preparing the room, preparing even myself, how I'm going to talk to them, the way that I communicate, my voice tone, and then even to give them a little bit of affirmation that, okay, this is common. You're not the only one going through this. And we've been seeing a lot of cases that they got better. So usually this is how we can even get more information from them.
That's amazing. Yeah. So Andrea, what would you say to women who feel disconnected from their bodies after an injury, an illness, or even having kids?
Naturally, and this is in our own nature, women, we tend to care for everyone else and then for us. So for this women, seek for what makes you happy. Seek for you, again, for yourself. And whatever you want to bring to your life again, it makes you happy and from your soul, and especially to put yourself first and to understand that you need to move and exercise for health, That's the first number one reason, most than the look. And this is going to bring a lot of positive things into your life. And exercise heals, if not everything. It's going to make you feel better, to improve your mood, and it's going to, and whenever you feel happier, things around you will be much better.
All right, ladies, thank you so much for sharing such valuable information, much of which I also didn't know. So it was very, very informative to have you here today. Thank you.
Thank you for having us.
Thank you so much for having us. It was a pleasure.
Well, thank you all for listening to FSHN Talks. Stay tuned for our next one.